Hi. I'm robo-Suzie and today I'll talk to you about what to do for hemorrhoids. Also don't forget to check out the link below, for the most comprehensive, multifaceted program for fixing hemorrhoids. It has a very high success rate. But back to our topic. Many people suffer with hemorrhoids in silence. Even though this condition affects millions and millions of people, and in fact, most people will at one time or another develop either an internal or an external hemorrhoid, many suffer without ever saying a word about their condition. The reason behind the silence is the embarrassment of addressing the subject with a healthcare provider or someone else who could help. If you are reading this article and asking, what to do for hemorrhoids? Or how do I know if I have hemorrhoids? This small amount of reading can help give you answers to those questions. Signs and symptoms of hemorrhoids. Pain and discomfort when passing stool. Noticeable bright red blood on either the toilet paper, the stool itself, or in the toilet bowl. Abnormal itchiness in or around the anus. Before you can determine what to do for hemorrhoids, it is important to understand what a hemorrhoid is and the causes behind this painful condition. A hemorrhoid is nothing more than a varicose vein. Depending on the location at which the varicose vein develops determines what type of hemorrhoid it is. If the hemorrhoid develops inside the anal canal, it is called an internal hemorrhoid. If the hemorrhoid develops near the anus, it is deemed an external hemorrhoid. Because of the nerve endings around the anus, external hemorrhoids tend to be more painful than internal hemorrhoids. However, if an internal hemorrhoid begins protruding to the exterior of the anus, pain or extreme discomfort can ensue. Hemorrhoids can develop when extreme pressure is put on the anal region or the anal region is exposed to increased pressure for long periods. Sitting or standing for long periods of time without significant position changes can help in the development of a hemorrhoid. Straining when trying to have a bowel movement due to constipation can also lead to the development of a hemorrhoid. Pregnant women can develop hemorrhoids due to the increased pressure the uterus places on the ventral veins as the fetus develops. The negative effect of this pressure can lead to a hemorrhoid usually during the last months of a pregnancy when the pressure on the ventral veins is the greatest. Eating and drinking habits can also be a factor in the development of hemorrhoids. If a person's diet is low in fiber and or their fluid intake is not sufficient, the possibility of developing a hemorrhoid increases. Because of the adverse effect smoking and the consumption of alcohol has on the circulatory and vascular system, these two activities greatly increase your risk for hemorrhoids. If you become aware of your hemorrhoid during the early stages of development, changing your dietary habits, to include more fiber and the proper amount of fluid intake can help to resolve the issue. To increase the fiber in your diet, be sure to include whole grains, vegetables and fruits with every meal. You also want to reduce your fat intake, because excess fat can have an accumulative effect on the vascular system, which will lead to more vascular problems, including varicose veins and hemorrhoids. For severe cases of hemorrhoids, more invasive procedures may need to be considered. A healthcare provider has at her disposal several treatment options that will remove the hemorrhoid. The options a healthcare provider may use include injecting the hemorrhoid with a chemical designed to shrink the hemorrhoid. If a hemorrhoid has developed a blood clot, this is called a thrombosed hemorrhoid. The blood clot can be surgically removed. After the thrombectomy, the hemorrhoid can then heal naturally. If you have a severe case of hemorrhoids or bleeding from the anus, it is important to consult with your healthcare provider to see if such drastic measures are needed. In very severe cases, a hemorrhoidectomy may need to be performed. Though this is usually an outpatient procedure and the recovery time can be long and painful. If the hemorrhoid has not progressed to a level in which such drastic or invasive procedures are necessary, topical ointments and creams may be used during the natural healing process. These over-the-counter ointments and creams are designed to numb pain and reduce the swelling of the inflamed and swollen vein. I've often been asked what to do for hemorrhoid discomfort. Many people have found using a sitz bath or soaking in warm plain water for 10 to 15 minutes can give much needed relief. The warm water will increase the blood flow to the area, while soothing the inflamed tissue. No matter how you choose to cure your hemorrhoid problem, whether it be through surgery, medication, or a natural remedy, always remember it is important to address the issue. Ignore the problem, suffering, and hoping it goes away, is a recipe that could lead to a more severe and painful condition. That's it. Thank you. Please subscribe, comment and like this video if it was helpful. See you soon.